My name is Santhosh George Thomas. I am a neurosurgeon, been a neurosurgeon for over 13 years now. I am part of Macquarie Neurosurgery and work at Macquarie University Hospital. At Macquarie, we believe in a collaborative team-based approach where we strive to achieve the best for our patients. My sub-areas of interest are cerebrovascular surgery, which deals with the vascular conditions of the brain and the spinal cord, spine surgery, and particularly neuro-oncology and skull-base surgery. Skull-base surgery is a very specialized branch of neurosurgery that involves removing lesions at the base of the skull. So the base of the skull is where the base of the brain rests, and approaching this area is pretty critical. The challenge of skull-base surgery lies in accessing these areas without having to cut any of these structures and without having to displace much brain, thus providing the best outcome for your patients. This is an illustrative case about a young patient who came to us with a sizable skull-base tumor. It originated from the base of the brain and grew into the brain, had a maximum diameter of close to about 5 centimeters, which is a very large tumor. Interestingly, this tumor grew around all the major arteries of the right side of the brain. So the arteries were within the tumor. Now, even though it had the characteristic features of a benign tumor, which is a meningioma, it still needed removal because of its sheer size, and it could continue to grow, and there is significant risk of encountering severe complication, which could be in the range of 10 to 20%. So the key challenge lies in carefully strategizing a surgical resection, which maximizes the removal of the tumor, at the same time ideally preventing or minimizing complications and preserving all the normal structures of the brain. We used the BrainLab navigation system, which is a system into which you import all the MRIs, the CT scans, and the angiogram of the patient, and then we are able to plan in real time with the patient on the operating table. That allows us to navigate, and it kind of shows us where we are during the operation. It also helps us to preoperatively mark the tumor, the parts of the brain, all the major arteries. We can color code them, and then that serves as a navigation tool, or in other words, like a GPS to help us during surgery. So it took us a good couple of hours to peel this tumor off the brain and off all the major arteries that were encased by the tumor. We accomplished removal of the tumor with remarkable success and resulting in very minor side effects. The patient made a smooth recovery and now has successfully crossed the challenging phase of this operation. I'd just like to say that this is just an illustrative case of open skull-base surgery. The surgical outcome cannot be exactly translated. Every patient's different, every tumor is different, the outcome for every patient is different. I would encourage you to go by the advice of your regular medical practitioner.